Greetings, Timothy Johnson, Digital Apothecary, and this is a continuation from a previous segment I did on two areas I think that pharma and digital health companies need to focus on. So the first one I talked about was having an educational strategy to get basic clinicians and other people to par in terms of how to use their products, and by and large, trying to educate the space on digital health. The other one is market shaping, and this is one that I think could use some significant work. So there is, by and large, I would say, still little understanding across, let's suppose, a whole healthcare professional space: nurses, PT, OT, nurse practitioners, nursing, physical therapy, yeah, it's a PT, physician assistants, pharmacy, and most people in medicine about digital health. And I mean, like a lot of people say, well, this stuff's been around for over a decade, even longer if you go back to e-health, m-health, and now digital health movement. But look at our journals. Like, it's only recently that I saw New England Journal of Medicine, a publication actually called Mobile Health. It was m-health basically, and that was published this year. It was a good review, just trying to get people up to speed on it. So we're in heading into 2020, and this stuff is still only marginally coming into our main journals about it. Our guidelines aren't really up to par at talking about this stuff at all, probably because the evidence is still being generation, but I don't even know if it's a big talking point. Probably the American Diabetes Association is probably one of the only ones I've seen that has been trying to push like continuous glucose monitoring. And then I think ESC has something in hypertension about mobile apps to help monitor and track blood pressure. You also have the AMA, or American Medical Association, that is putting out their digital health playbooks. First one's remote patient monitoring this year. And then you have APA, which is talking about how to evaluate mobile medical apps, especially in the psych space. So in medical context, I would say it's very blah. Like I don't see stuff like on MedPage Today, Pharmacy Times, large of like amount of news area that's talking in the medical news area that's talking about digital health. Even though you have like Eric Topol being one of the editors for these areas, and there's some marginal talk, but who talks about it most? It's still VC investors, tech people, um, some like of the health IT news areas like Fierce Health, Moby Health News, and such. But I would say by and large, most healthcare practitioners are not even aware of that. And then I would say because of that, there's two populations that probably, or maybe possibly three, but two that really need to be targeted well. The third one, why I was tangentially saying that, is because I think digital health companies are targeting patients in certain areas. Like I look at like psych, like Headspace and mental health. There's definitely when they have a B2C market, or when they're trying to directly engage patients as their number one consumers, and not really caring too much about clinicians recommending. It's kind of like that's there, and then there's a market shaping occurring there. But then you have like healthcare practitioners, and then the people who have the drawstrings that actually buy this stuff or put out therapy and formularies and such. So those are two areas that stand out to me that needs some really big inroads. And the reason I say this is because it's recently I've been on several focus groups and advisory boards for different organizations talking about digital health. I was at the AMCP meeting about digital therapeutics, and they're going to be releasing their white paper on this topic. But the one thing I will say is, even being at that meeting, which was filled with a lot of top-notch people, there was still a lot of debate about what the stuff is or what it even meant, and a lot of explanation had to be handed out just about what is digital health. So we still have a large amount of room to basically provide a lot of education on digital health. And I think that's really important in terms of if you want to create a market where people want to use your products and recommend it to their patients, and if you want people to buy the product and use it and provide it as care on a formulary, by and large, at least people need to have a knowledge base. And I don't think it's really there present. And there's two things that really stand out there that for me is because you have different parties that are creating their own narrative. And what I mean by that is all the rage right now is I want to be a digital therapeutic because it's a sexy term. So my product's a digital therapeutic. Even though you have the Digital Therapeutics Alliance, and then you have Node and Health XL that just put out a group position thing that's saying this is what digital medicine is, this is what digital therapeutics. You still have people who have products that even I look at like that's not digital therapeutic, like, but you want to be called it because that's a hot thing right now. The second part is basically, besides supplying your own narrative, is I think that also goes along with trying to undercut your competition. And so digital health companies and even pharma, I think, are going to have different terminologies being used. Like if I was talking about medication here, and that's been something I've been on, is like you had like virtually observed therapy, you have directly observed therapy, you have wirelessly observed therapy, you have like all these different terminologies that exist. So there's no clear definition. So when people have the same conversation, start throwing out terms, what you quickly realize is that they're not even on the same page about it. So even people who are slightly knowledgeable or intermediately to high knowledge, the terminology just gets thrown around. I think it's a mess. Um, so I'm not really in the base saying that we need a standardization of terms and definitions, but more or less that there needs to be more understanding of what is at least the underlying premises that are being talked about. Like telemedicine is kind of easy because that's I think most people grasp onto, but like mobile apps, mobile health apps, prescribable apps, digital therapeutics, the use of wearable sensors, stuff like that. Um, what is use of like if we go down the whole lines like augmented intelligence and machine learning and data and such. If we start going into like studies and such, if we're talking about RCTs versus real world evidence generation, what that implies, like those are things that to me like are hot topics, but they're not really well understood. And someone's got to do a good job of trying to create materials and trying to get this stuff all out. I would. So where do I see that happening? How can you do really heavy rooted market shaping? Um, Probably several areas is probably start targeting where do people really find media and get up to date. And this is for different populations. If it's new trainees and people in school, do you want to target the schools and say, hey, maybe if you want to consider digital health as something, maybe here's some, media or some stuff that you can use to insert into your curriculum. If it turns into CEs in generation there, well, not everyone goes to talks, not everyone can go to like a dinner and such. So, that's one route that you can do, but can you have any other media? Can you do printed stuff? Is there videos out there? Is there articles that can be pushed to be written about that can break down this stuff? And I think that's to me is one big thing is that we need good case studies. We need good best practices just before because I think the more that you have people in clinical space seeing this, then they'd be like, oh, okay, that makes sense. Like I do something similar, and this is a tool that would really augment how I currently practice. And if people are doing this, or we see that, show me the evidence, how do I interpret it, and such. Okay, okay, we're getting to a point because if you start saying, oh, we have a digital therapeutic that helps with lower back pain, it's kind of like, how? What does it do? Do you just put the phone in your back and it helps? No, okay. Well, it provides a level of therapy that's modulated for a person to help them out stretch and such like physiotherapy. But then why not just go to physical therapy? So it's kind of these kind of things. I know this kind of video goes along with what I talked about before about education, but to me, market shaping goes beyond just targeting the clinicians. It now targets almost all the people in the healthcare space. And this is where it comes to the other population is people who have the drawstrings of money. So this could be like hospital administrators. This could be other administrators who are basically saying we're going to engage and use these products. A lot of these people may be business as well. And may not even have a healthcare background, so they may need a different mechanic to be, educated on what all this stuff means. I mean, there's some definitely early advancements that are going on, but I think a lot of these people are trying to play catch up because they see all this stuff going on. Like you see Walgreens closing their mini clinics, you see other people going on direct to consumer prescription services online. You see other people popping in telemedicine. So these guys are now thinking, okay, well, look at a lot of hospitals, like rural hospitals, are hemorrhaging money. A lot of them are closing doors because they can't keep afloat. If they need to keep in this game of business for healthcare, they're going to have to need to adjust for changing times. So how do they do that? Where do they have to learn? And I think this leaves a lot open for how to basically change how people view the healthcare market. And this is why I call it market shaping, is because I think the by and large one big mistake is there's so much focus on let me raise capital, let me generate evidence, and let me get this thing cleared or approved by the FDA and put it on the market, and then bam, we're there. And then it's like you open up your gates and you're waiting for a flood of people to come in, but no one comes in because no one even knew you were available or what you were doing. Or what it even means. Maybe we get a few stragglers or like early adopters, but still, numbers matter in healthcare, and you have to really get to that point. So The market shaping is definitely not too much. I would say it's going to be very heavily marketing. At the end of the day, like how do you market digital health? How do you market this stuff? Then what's going to be very interesting to see, even like some digital medicine products. I follow some digital therapeutics. Like, is this like TV ads we're going to see? Is this going to be like editorials? Is this going to be like how this stuff is going to start popping up in people's media consumption, and how are they going to know about it and see it, and then are they going to be like, okay, are you going to write it at a very basic level so you can kind of get an idea, like how do you go to intermediate, how do you go to expert level, so they get like a good scalability? Because if you drop everything else at once and they don't even know what it is, you're going to be like, okay, I have no idea, this is like sci-fi, throw it away, or like, oh, this is too much. But if it's too simple, they'd be like, oh, that kind of makes sense, but like how do I do it and such. So this whole educational thing goes along with market shaping together. I would say like you can't just do one, ignore the other. I think both have to happen together in order to really make this whole digital health space kind of get bigger and get more buy-in. Because I think that's where we're currently at. I don't really think digital health takes off for the next 5 years. And the reason I say that is because I think people are still trying to figure this stuff out. But I will say that those digital health companies and pharma that have an interest in digital health that can influence digital health education and market shaping and build a brand awareness and presence will probably be likely the winners at this time, just because people are going to recognize and get into it and understand it and want to use it, versus those who just focus so much on product and then try to slowly have an uptake in use. I think they might have a hard time penetrating the market as time goes on. So yeah, I think money's going to be dropped. I think there's going to be some big work on the space, and I think this is something we're going to really pay attention to and spend a lot of time thinking about, like what is a good way of doing this. So in any event, this is Timothy Youngs, the Digital Apothecary. Take care and have a good night.